Crapo, we're seeing it all the time in Oregon and Idaho, and we're going to be working together. Senator Stabenow.
Thank you very much, Mr. Chairman and Ranking Member. I so appreciate the focus that you're giving and the leadership you're giving on this. And I have to say, Dr. Murthy, I so appreciate your report and focus on young people. We know that 1 out of 5 Americans will have a mental illness in their lifetime, and that number actually may be going up as related to the pandemic. As the chairman talked about, and I think there are many, many of us in this chamber who have experiences ourselves or our families. For me, it was my dad being bipolar before there was a diagnosis, before there was treatment, before there was medication. I saw what happened when he didn't have those things and then when he did, and the transformation in him and our family. And so I wish that for everyone, which means we have to treat healthcare above the neck the same as healthcare below the neck. So that's part of getting rid of the stigma. But we know that children and young adults have been particularly hard hit, and certainly your report shows that anxiety, depression, other issues have become way too common, and far too many children and young people have gone without treatment, and social media only makes it worse. Every single day. So our children need help, and I'd like to talk about 2 different venues to do that. One is school-based health centers, which I think are absolutely essential in addressing what's been happening, particularly now with the pandemic on school-age youth. And school-based health centers can provide critical behavioral health services, both addiction services and mental health services, as well as physical. And we're inching along. I mean, back during the Affordable Care Act, I was able to get $200 million over 5 years into the ACA for infrastructure to create health clinics, but we've never actually put money into the operations every year. And so this year, there's $60 million included in the Senate appropriations money in the House as well for the first time for operations. And we need to do more to really strengthen that. Senator Capito and I are working. We have legislation, healthcare for hallways to move forward to really aggressively address what we need for our children's schools. So could you speak to the importance and benefits of reaching children in school-based settings like the school-based health clinics, and how can we use them to expand what we need to do in behavioral health?
Well, Senator, thank you for that question, and thank you also for your leadership on this issue, for all of your work to support and get certified community behavioral health centers in communities across the country. Look, one general principle in healthcare that I believe applies here as well is that you're better off if you bring care to people where they are. Our kids are in school. The better we're able to bring care to schools, through counselors, school nurses, school psychologists, the more easily we're going to be able to identify mental health struggles early and get kids the care that they need. That's why I think school-based clinics are so important. It's why the investments that were made through the American Rescue Plan to give billions of dollars to schools, in part to help them hire more mental health providers and counselors in schools, was so important. But we have to sustain those investments over time. I mentioned earlier that it's 11 years, typically, between the onset of symptoms and when a child ultimately gets treatment. We have to shorten that time frame. We can't let kids struggle and their families struggle for 11 years. And getting care to them where they are in schools is one important way to help do that.
I totally agree. And then the second piece of that is that after they've been identified, they're getting help in school. If there's no community-based care, then it all drops off, which is why, as we talk about certified community behavioral health clinics, this is about institutionally creating parity in the community between physical health clinics and behavioral health clinics. And that's why this movement, I'm so proud that Senator Blunt has joined me in this, and members of our committee, certainly the chairman, and the work that's been done in Oregon on this is really significant. We have a broad bipartisan bill to extend the opportunity across the country, which is absolutely critical because, first, You have to have services in the community. The services that are being provided now in places with funding are providing services to children. We know that about 25% of the services now being provided through the behavioral health clinics are to children, and more can be done, and they're working with juvenile delinquency facilities and criminal justice facilities and so on. And the most important thing is that they are meeting people where they are, meeting children where they are. Traditionally now, the mental health system has taken only those who are very seriously mentally ill under Medicaid. This is about everyone who presents themselves, every parent who presents themselves at a clinic with their child, and they're required to be able to get access to services and so on within a week, which is transformative, as well as the psychiatric crisis services provided. So I wonder if you might speak more about what we have dubbed the CCBHCs, it's a mouthful, but dealing with behavioral health for services and the important role of community-based services.
Well, thank you, Senator. I cannot emphasize enough how important it is to have treatment accessible to people in their communities. And ideally to have that combined with virtual care services to provide maximal points of access. Mental health is a delicate issue for many families, and being able to go to places and people they trust is often essential. Knowing that there's a center in your community can make a big difference for someone who's wondering whether they should step forward and get care. But what's also important is that the care that's delivered, whether it's for mental health concerns or substance use disorders, is actually evidence-based care. Which is why I believe the CCBHCs and the standards that they are working to uphold, such that all evidence-based treatment is being made available, is very important. And so my hope is that through a combination of in-person services and virtual services, we can ultimately provide the network of access that young people need to get the health care they deserve.
Thank you, Mr. Chairman.
And Senator Stabenow is going to continue to pioneer